Have you or a loved one been diagnosed with diabetes? Sadly, chances are the answer to that question is yes. But that's why tonight's demonstration is going to be especially useful for you. Because tonight, I'm going to be demonstrating how to perform a subcutaneous injection, or an injection into the fatty tissue. And you may be wondering, wait, how is subcutaneous injection related to diabetes? Well, the medication used to treat diabetes is insulin. And insulin is injected in a subcutaneous manner. So, moving on to the demonstration, your first thing you want to do is to gather your supplies. The supplies that you'll need are your needle or your insulin pen, your alcohol pad to clean the patient, which I've already opened here to make this a little bit smoother, and you're going to need a band-aid, and also need your patient, which this is my patient. This is Miss Granny Smith, and we're going to be injecting the subcutaneous injection into her stomach, which is right here. Well, once you've gathered your supplies, first thing you're going to do is take your alcohol pad, which is here, and you're going to clean your injection site, which is here. So to clean this, you're going to find where you're going to inject it, and you're going to start cleaning at that spot in a circular motion, and you're going to move outwards, continuing in a circular motion, and you're going to do this for approximately 1 to 2 inches. And the reason you want to do that is because nobody has perfect aim, and you may not hit exactly where you plan on hitting with the needle, and this will prevent infection by ensuring you have a larger area that is free of contamination. Once you have Miss Granny Smith's abdomen cleaned off, you're going to take your needle and you're going to remove the cap carefully, not to stick yourself. Set the cap to the side somewhere. Now once you have that and you have your needle uncapped, you're going to take your patient's abdomen and you're going to squeeze the stomach, the fat on the stomach, like you're essentially like you're pinching somebody, except you're going to grab a larger amount of area. Once you have that and you've got it squeezed, you're going to take your needle and you're going to insert it at a 90-degree angle, like so. And once you have that inserted at the 90-degree angle, you're going to pull back on this back white piece of the syringe. And this is called aspirating. You're going to aspirate or pull back on the syringe to ensure that you have not entered a vein or an artery or a capillary or any sort of blood vessel. You want to do this because injecting a medication that should be subcutaneous and injecting it into an artery or blood vessel can be very detrimental to the patient, because you may be giving them too much medication for that route, and that can cause just as much, if not more, harm than them not getting the medication at all. Or the medication may not be effective if it's injected directly into the bloodstream, which is just wasted their time and your time, and potentially delayed them getting the care they need. Once you have aspirated and you're not in a blood vessel, because you have no blood in the syringe, then you're going to push back on the plunger, and that's going to inject the medication into the subcutaneous tissue. Once you fully push the plunger all the way back in, slowly withdraw the needle, and if you have a needle with a safety built into it, you'll simply push down on it. It'll be right here. You just push down and it'll cover the needle, and that's what these are. But if you don't have one, then you're going to put it immediately in a sharps container. If you don't have a sharps container readily available, you use a water bottle or a Gatorade bottle, soda bottle, any sort of reclosable hard plastic container will work. And just recap Picking my needle and putting it to the side so nobody gets stuck. To reiterate why this is important, is insulin is a life-saving medication for those who are in a diabetic emergency, which most commonly is hyperglycemia, which means high blood sugar. And insulin, as previously mentioned, insulin is used to treat that through a subcutaneous injection. And if somebody is suffering from high blood sugar, they may not be in the right state of mind to self-administer the medication, and it may be you that it falls to. The key takeaways from this is protect yourself by washing your hands, wearing gloves. Protect the patient by washing your hands, wearing gloves, cleaning the site with alcohol, and inject the medication at a 90-degree angle. And prior to pushing the medication in to the body, pull back on the plunger of the syringe to ensure that you do not hit a vein or an artery. Remember these key steps tonight, and you may have the chance to save a life. Thank you.